would like to share with you the x-rays of a 67-year-old patient for whom I have done PRS treatment today. She has been suffering from knee pain for the last 10 to 15 years. This one here is the AP standing x-ray of both the knees. You can see that here in this close-up view. Left knee was more severely affected. This is the left knee. The joint space on the left knee on the inner side is narrowed. This is a severity of 4, but fortunately her pain scale, that is on a scale from 1 to 4, was only 1. She was able to manage her routine chores and had also improved from Ayurvedic treatment. So therefore I suggested a PRS treatment to her, and she was only willing for the PRS treatment. She had seen me 6 months back. At that time I had informed her about the knee replacement. She didn't want that and she chose to have a PRS treatment. She saw another patient and was impressed by the result in that patient. So she came and she was convinced, and yesterday again I explained to her the pros and cons of a knee replacement and a PRS treatment. She was really scared of a knee replacement, and she has chosen to undergo a PRS treatment today. So I have done this for her. These are the x-rays. I will show you the MRI scans also. This is the side x-ray or the lateral x-ray. You can see here that there are bone spurs here on the left side, at the back of the knee and at the front of the knee. Right knee is not so bad. Here the right knee joint space is preserved as compared to the left knee. These are the merchant skyline views. Right knee, there is some cartilage preservation in the under the kneecap. Left knee. So these are the x-rays, and I'm going to show you the MRI findings. She got this x-ray done in another hospital. You can see here. She has been around in the hospital. She's done a lot of shopping. She was advised a knee replacement at this hospital, but yet she has come to me for the PRS treatment, and she's feeling much better. I will share her testimonial with you. So these are the x-rays done recently, 23rd of January 2024. So today is the 26th of January, Republic Day. 4 days or 3 days after this visit, she has come here. So more patients suffering from knee pain are doing their shopping. They are not convinced about knee replacements. They've heard from their relatives that knee replacements can go wrong. There is persistent pain, and they are preferring to have a PRS treatment. So this is the proof here. I would like to point out the shortcomings in the radiological investigations done at other places. These are the x-rays from the other hospitals. I just showed you that. And in the first instance, I showed you the x-rays done here. I will put them up once again. I'll remove this and put them up here. If you remember, in the hospital where I work, there are 2 x-ray plates here and third x-ray plate here. So you can see that I do a thorough investigations. I get standing x-rays of both the knees here, lateral side standing x-rays of both the knees here, and most importantly, these are the skyline views to evaluate the kneecap or the patella. So these investigations are taken very lightly, and surgeons proceed on that. So they just go by this alone, this standing AP and a lateral. Nobody bothers to get the skyline view. As a result of this deficiency in their practice, their knee replacement practice will also be in line with this, because they are only evaluating one side of the knee which is affected by arthritis, and I will show you in the MRI scan that it is more than what is seen on this x-ray. This side is definitely affected because the joint space is narrowed as compared to this side, but this side also showed bone edema. So I have treated this also, and most importantly, they have not requested for this X-ray at all, the skyline views. So if they don't do a skyline view, they can never recognize in advance what is happening under the kneecap. So when they don't plan for it, they will not do the complete knee replacement for the knee. They will only do a partial knee replacement, replacing the inner side. They will not bother to evaluate this, and they will not replace the undersurface of the kneecap, patella, and that is why that can be a cause of persistent pain. And this is the reason why patients continue to suffer from pain after a so-called total knee replacement. Remember, a knee joint consists of three compartments: an inner compartment, an outer compartment, and a kneecap compartment. So half-hearted treatment. I have discussed the importance of getting 3 views of the knee. You have to do a thorough evaluation. For this you need 3 views: AP, standing, not lying X-rays. I have showed you in a previous video, check it out here. The importance of getting standing X-rays and not just relying on lying X-rays, because lying X-rays lie. They don't get a skyline view. This is called a special skyline view, merchant skyline view. And you see both the knees have been evaluated here. Instead of a half-hearted examination of one knee, AP of the knee and lateral of the knee, not bothering to see the other leg, not bothering to evaluate the patient as a whole, not bothering to get a skyline view to see the kneecap. So I was talking about doing MRI scan, 3T MRI scan. We just saw and discussed the half-hearted study of the knee. They didn't bother to get a skyline view. They just took a standing X-ray. I told you that I will be showing you that the outer half of the knee also was affected. So you remember we saw the narrowing, joint space narrowing on the inner side on the X-rays. So this is the inner side. But surprise, surprise, outer side also is showing bone edema over here. This is the outer compartment, and this is the inner compartment where there was joint space narrowing. You can see bone edema over here, white area. But surprise, surprise, in the center of the knee also there is bone edema here and here, and on another view here. 3 Tesla MRI will reveal all that. Bone edema. What is the point in doing X-rays without studying the whole knee? So you can see that the importance of doing a 3 Tesla MRI. There is edema here, and obviously if you are doing a cartilage surgery or a PRS injection, you have to address these areas. Even if you do a total knee replacement, if you don't have a study of this side, you may end up doing a partial knee replacement, thinking that only this half is affected, only the inner compartment is affected. You may not do a total knee replacement at all in the first place. And even if you go for a knee replacement, it will be a 2/3 knee replacement rather than a total knee replacement, because 2/3 of the knee is inner side and outer side, failing to address the kneecap, as I've showed you before, patellofemoral joint, failing to replace that. So this is the cause: poor evaluation, poor concentration, and failure to address the entire pathology inside the knee joint. So these are the MRI scans of the patient. This patient's son has recently seen the video which I have uploaded over here of the importance of getting 3 Tesla MRI scan for the knee joint. We will hear from him, and he rang me up 2 days back and said, I want to get the MRI and I want to get the procedure. Obviously he must have been unhappy with the other thing. So he has gone for the treatment of his mother today. We'll be sharing her testimonial soon. I will share the procedure also up here. It was done in record time of 45 minutes. I have recorded a video. You can see that up here. So thanks for watching. This is how I evaluate patients thoroughly. I get MRI scans, standing X-rays, 3 views, standing AP, lateral, and merchant skyline views, and 3 Tesla MRIs. And I forgot One more thing, there is a cardiogram also which the patient does not have right now. I will show you in another X-ray, in another video, where the patient has done a cardiogram, but they don't have it right now. So every total complete radiological evaluation is done. If you found this information useful, share it with your friends and relatives. Subscribe to my channel MJRC Madras Joint Replacement Center. I'll see you in another video. Cheers. Bye.